Good morning. Today I'm gonna talk about Trastuzumab deruxtecan in patients with central nervous system involvement from HER2 positive breast cancer. This is a deep trial. Regarding about the authors of this article are Pérez García and collaborators. I am Soraya Hernández Manuel. I am medical student of the Benemérita Universidad Autónoma de Puebla. Trastuzumab deruxtecan has shown durable antitumor activity in treated patients with HER2 positive advanced breast cancer, but its efficacy has not yet been evaluated in patients with activity brain metastases. This is important because when it comes to talking about this drug, Trastuzumab deruxtecan, it only talks about the breast cancer, but this research focuses in the field of brain metastases. Approximately 30-50% of patients with HER2 positive advanced breast cancer will develop brain metastases. This may be explained by the challenging delivery of many therapies to the central nervous system due to the blood-brain barrier. For example, many drugs can probably cross the blood-brain barrier but don't reach the therapeutic levels that are needed. This ongoing 5 cohorts phase 2 study enrolled patients with mutated HER2 positive. This is important because there were 5 cohorts, but we will only focus on 3 of these. For example, in the cohort 1 there were 8 patients after local therapy. In the cohort 2 there were 4 patients asymptomatic untreated BMs, and the cohort 3 there were 9 patients with progressing BMs after local therapy. This diagram shows the total number of patients, where several patients left the project for these reasons, among which are death, clinical deteriorations, drug, physical decisions, more or less. And of the remaining, 36 were divided into the cohorts, cohort 1, 2, and 3, 4, 5. We will focus on cohorts 1, 2, and 3, because these patients were among those who started treatment with Trastuzumab deruxtecan. For example, here, and here. 4 patients in the cohort 1, 2 patients in the cohort 2, and 2 patients in the cohort 3. Of the 59 patients who were chosen, only 21 patients were receptor positive, specific HER2 positive. And this was found in the cohorts 1, 2, and 3. All enrolled patients were female, and the median age was 53 years. Patients received 5.4 mg per kilogram of Trastuzumab deruxtecan as an intravenous infusion on day 1 of each 21 days cycle. The first dose was infused for approximately 90 minutes. The treatment with Trastuzumab deruxtecan led to 16 weeks progression-free survival in 87.5% of patients in cohort 1, and intracranial objective response rate about cohort 2 and cohort 3 was 50% and 44.4% respectively. Is here cohort 2 and cohort 3, A, B, and C. This graph shows waterfall plots of the response in patients of the cohorts 1 and 2 and 3. The graph is marked in response to 20% and 30% negative here, and this is the response. In this study, patients didn't deteriorate from baseline at 6 months. Here we have adverse events, among which are fatigue, constipations, neutropenia, diarrhea, anemia, and alopecia. Trastuzumab deruxtecan showed intracranial activity with manageable toxicity and maintained the quality of life in pretreated HER2 positive ABC patients with stable, untreated, or proximate BMs. I express my gratitude to the Faculty of Chemical Science of the GUAP for the opportunity provided to the institutions in charge and the authors of this research, GRATEFULNESS. And this is my reference and my QR code where you can go to the official page. And that's it. Thank you, and I appreciate it.